Several metro area women recently began Heart Health Makeovers, a program designed by the American Heart Association in partnership with St. John Providence and Beaumont Hospitals. The American Heart Association held a breakfast to kick off its My Life Check Makeover, a program that enables participants to revamp their lives with direct, individualized input from doctors and physiologists in an effort to reach ideal heart health.
Well, the breakfast is actually about the joining of the American Heart Association and St. Providence Hospital, as well as Beaumont Hospitals, in this big makeover challenge. We don't really like to call it a challenge because essentially the women are not challenging each other, but they're challenging themselves to get healthy. And basically this is a new program, a pilot program. And we basically chose 8 lucky participants to undergo a healthy transformation. And so the transformation is actually based on mylifecheck.org, and that's the American Heart Association's newest online tool that anyone can access free. And the cardiologists and their health teams will work with these individuals to help them achieve their healthy goals.
The participants have many reasons for being a part of the program, but to become healthier is the primary focus during the makeover period.
Well, first of all, I guess I don't remember the exact number of the cholesterol, but I can tell you that my doctor said if I don't lower it, I'll have to go on medication. And that's for the first time in my life. Fortunately, my blood pressure is good, and I need to come down in weight and get in better health as well. So I am going to be leaning on the folks here with the American Heart Association and St. John Providence to help me with the tools and with my Life Check for Women to go ahead and reach my goal.
I decided to participate in the program because I suffer from some of the factors that women give you problems in terms of heart health. I have high blood pressure and I have diabetes, and unfortunately my father suffered a fatal heart attack and my mother has had a stroke. So I knew that this program was very important to me so that I would hopefully learn more and make better choices so that I would have a better chance of having a healthier life.
Over the course of the makeover program, participants will blog about their experiences in hopes of encouraging others to pay attention to their health.
We're going to be blogging about this and follow our story, see how we're doing it, maybe take the journey along with us. We're just people that are blessed enough to have these tools to reach our goals, but what we're trying to do is extend that out to other women so that we are kind of tools and encouragement for them. And I would love to hear from everybody if they're participating with us or if they have questions. We'd love to be of help, to anyone in the community who wants to.
The American Heart Association online has a My Life Check component, and then in addition they have a blog site, so these women as well as anybody in the community can go online and blog. They can, if you have never taken a My Life Check before, you can do so online, and then even though you're not part of this actual program, you can take the information to your doctor. And basically, again, we're trying to empower women to recognize that they actually have to be their own advocate, and sometimes they actually have to go to the doctor and tell them. Sometimes these women have to go to the doctor and tell the doctors what tests they need. So we like to help empower them how to do that.
As part of the program, the women are expected to meet with members of the health team every week. They will receive assistance in how to grocery shop productively, eat nutritionally, and stay on point for the program. Organizers see the Life Makeover as positively impacting the community.
Programs like this in the community are huge. I have really found in the last 10 years since I've been doing a lot of community service that you have the opportunity to make huge impacts on people. Everybody in this program is probably either a mother, a sister, a grandmother, a wife, a daughter. And what I hope to do is by empowering them to take care of their own health, that they will have at least 4 people, their own mother, their own sister, their own daughter, and a best friend, that they will tell. And if each of those people only told 4 people, you can imagine how this would be like a spider web and get across the whole Detroit area. Detroit is certainly one of the heavier communities. It's one of the more oppressed communities, and I think the stress in this town is very, very high. And what I hope to do is get the word out that no one's alone and that everybody has someone to work with, and that the American Heart Association and Go Red is there for the whole community, not only these 4 women.
The breakfast is a precursor to the Go Red event in February, where participants will be presented to the public with a new health outlook.
In February of 2011, I hope that currently I'm taking some medications for high blood pressure and diabetes, that perhaps I will see that I don't need to take as much medicine as I'm currently taking. I think that I still struggle with high blood pressure. When I go to the doctor, I still don't like the numbers. My doctor doesn't like the numbers. And hopefully in 12 weeks' time, we'll see a big difference in the high blood pressure or the pressure rate. I hope that maybe a part of the journey will show that I've lost a few pounds and my BMI has improved, my body mass index number has improved. And I think the journey will also help me just really learn to eat better, to love exercise more, and just be totally happier and healthier.
I hope to have lowered my cholesterol significantly through diet and exercise so that I don't have to take medication. I hope to lose 10, maybe 15 pounds and to be in much better shape physically. The Go Red for Women luncheon, I guess there's going to be a big reveal with all of the people that are participating, and I'm confident that all of us are going to meet our goals.
The American Heart Association is striving to spread awareness of heart health, especially among women. To learn more about programs like Go Red for Women or other AHA programs and events, visit AmericanHeart.org.